thank you, Mr. Chairman, and thank you for your consistent courtesy and professionalism. This hearing is focused on what happens to Americans after they've been treated at the hospital. We have a number of important portions of the healthcare industry here to discuss different aspects of post-acute care. But I don't believe you can talk about access to post-acute care in America today without talking about Medicaid. It is the primary payer for this care. It covers 2/3 of all nursing home residents, 60% of all home and community-based services. It pays for the long-term support for 9.3 million seniors and individuals with disabilities. And that care is on the chopping block. $880 billion proposed to be taken out principally from Medicaid in the Commerce Committee. The plan that Republicans are offering for skilled nursing homes is one to take the nurses out of the nursing homes, as they promise to pay for some of these actions by repealing the extremely modest minimum nursing staff standards that were adopted by the Biden administration. After giving private equity-backed nursing home operators carte blanche to reduce care and slash staffing in the fashion of Musk's Department of Government evisceration, Republicans will be cutting a significant amount of the financial backing for each of the different aspects of healthcare represented today. After repealing the minimum staffing requirements, Republicans intend to cut the funds that pay for nurses and ensure that our most vulnerable loved ones are not left on the hook for a nursing home stay that can cost $100,000 a year. This post-acute care plan amounts to a prescription for a mountain of medical debt and a preventable death sentence for some people. Last week, I heard from one concerned Austinite who resides in a nursing home. Her closest family member lives in Florida, and she has no means to travel back and forth there and pay for her nursing home if Medicaid is slashed. She understandably told me, quote, "I'm very afraid." Many adult children have written me concerning a loved one, a parent with dementia or Alzheimer's. Again, unable to personally provide the 24/7 care that is necessary. These are folks who don't know how they'll get by without Medicaid. Similarly, I've heard from the parents of children with a variety of complex medical conditions and disabilities who require home health aides, costly therapies, and eventually may need to reside in assisted living. They seek assurance that their children will live with dignity, health, and the support that they deserve. The only thing I'm sure of is that if enacted, the Republican budget plan will harm each of these families. The Independent Congressional Budget Office confirmed this last week. After setting aside Medicare spending, which Republicans have promised not to touch, through the trillions they would add to our national debt endangers the stability of those programs also. It was pointed out by the Congressional Budget Office that aside from this direct Medicare spending, 93% of the funds under the jurisdiction of the Commerce Committee, which has been told to cut almost $1 trillion in order to finance more tax breaks out of this committee, 93% is Medicaid, and of the remainder, 7% is CHIP. So healthcare is on the chopping block, particularly post-hospital acute care. No matter how you slice it, this budget demands cuts that will harm so many Americans, all to further enriching a handful who are already doing quite well. Under this budget, we don't just have to worry about what happens after the hospital. There will be acute need everywhere, widespread. I look forward to hearing from each of our witnesses, though I'll be interrupted by a quick trip to the floor on another bill from Ways and Means that was scheduled, unfortunately, at this time, because millions of people are at risk from this Medicaid cut. Thank you, Mr. Chairman.